So I have sort of two different groups of patients that I end up treating. One are the trauma patients, so the people who are in bad car accidents, take tumbles down the stairs, and have spine fractures. I get to play the hero in that. They think they have saved their lives, and it's not just me, it's a whole team that's helped take care of them, but those patients are particularly rewarding for me to work with. And then in the office, I see a very different type of patient. Often my patients come in complaining of long-standing neck pain or back pain, and I'm a big proponent of avoiding surgery, truthfully, both for myself personally, but also professionally. I think in the long run, especially with spinal surgery, because it can be pretty complex, that if you can avoid a surgical intervention, you probably should. And so I usually encourage them to explore some of the other treatments that we have out there, working with pain management, some interventional techniques that can be tried, physical therapy, things like that. And if they get to a point where none of that's working and there is a surgical option, then that's the right time for them to do it. So nowadays, we do a number of different approaches to the spine, and some are the traditional methods, what I call open spinal surgery. And then over the last 10 to 15 years, one of the things that has evolved in spinal surgery is what we call minimally invasive spine surgery. Now, not every patient is necessarily a candidate for it, and certainly patients who have had prior surgeries, it's often hard to then be able to undertake these types of procedures. But in those patients who are candidates, it offers them a shorter hospital stay, a quicker recovery, less blood loss often. And so I think it's a great set of tricks that I and many of the other spine surgeons here at Cleveland Clinic Akron General have in our back pockets to offer patients to help take care of them.